As an Indigenous woman, I'm very aware that every day that I'm in medical school, I'm working in a system that was not made for me.
Kelsey Allen feels family medicine could be her calling. The second-year medical student hopes to eventually serve her community, Halpu First Nation, back home in Newfoundland.
It's very important to me that as an Indigenous doctor, getting my medical education, that I do not come out on the other side of a medical conveyor belt as another Western doctor who is Indigenous. I want to be an Indigenous doctor who practices holistic medicine and who acknowledges that someone is more than just their symptoms or their disease.
Dr. Michael Dumont has navigated that tension throughout his career.
Many of us, grow up with a sense of shame in our identity, and having access to traditional healing methods and elders really helps to foster a more positive cultural identity and ultimately better mental and emotional and spiritual health.
Dr. Alika Lafontaine is a past president of the Canadian Medical Association. He says representation is improving.
I'm seeing more and more folks going to specialties that are needed within Indigenous communities across the country, moving into policy positions and also leadership within healthcare systems.
But barriers still exist, especially for students just starting their careers.
One is self-confidence and just not having that long history of folks who've been in the system.
Many students face is that they're forced to be not only in the learner role, but in the educator role for their peers. When we're in circumstances where, we're being taught Indigenous health content in our curriculum, oftentimes that entails some really uncomfortable questions.
Kelsey says she prioritizes finding peace amidst the intensity of the program, while remaining committed to being part of a change she hopes will last for generations.
The more that we can be inclusive and the more that we can make the space feel more welcoming, it'll attract more qualified Indigenous applicants, and we'll have more qualified Indigenous doctors.
Katherine Ward, Global News, Toronto.